Hello, everyone. Thank you for joining the Center for Victim Research's interdisciplinary panel on conducting rigorous victim research. My name is Jennifer Yonner, and I'm the Associate Director of CVR. The Center for Victim Research is a one-stop resource working to build a community of collaboration between crime victim researchers and service providers. And in 2018, CVR funded 9 researcher and practitioner fellowship projects, and today we'll be hearing from 3 of these fellows, including Liz Odongo, Kelly Knight, and Joseph Richardson. And in the short 30 minutes that we have together, I'm going to ask each panelist to briefly introduce themselves, and then I'll ask one question of each fellow. So first, we will ask you, Liz, to go ahead and get started. Could you please introduce yourself and your agency, and then briefly your fellowship project as well? Okay, Liz, we can't hear you, but I have unmuted you, so if you could just try again.
Is that better?
Yes, perfect, great.
Sorry about that. Good afternoon. This is Liz Odongo. I'm the Programs Director at the DC Coalition Against Domestic Violence. The DC Coalition is a federally recognized domestic violence coalition in Washington, D.C. We work in support of the dedicated domestic violence service providers and the thousands of adults and children experiencing domestic violence in the district each year. We do this through policy and systems advocacy, training and technical assistance, and public awareness activities focus on intervention and prevention. So as many of you probably know, it's Domestic Violence Awareness Month now. One of our projects and the collaborative that was funded under this fellowship is DVARC, stands for the Domestic Violence Action Research Collective. We're a multidisciplinary group of DC-based researchers and practitioners committed to designing and conducting community-based research. Our goals are to enhance individual and community safety, build survivors' power, and support policy and practice action efforts that improve survivors' services to survivors of violence. The focus of our work under this R2P fellowship has been to design a community-based research study to understand how survivors who are homeless or housing insecure navigate the homeless system in DC. We're in the process of conducting these interviews with survivors who have gone through this at the Intake Center for Families who are homeless to hear about their experiences and identify barriers to safe housing. We greatly appreciate this opportunity and are very thankful for our partners for their support.
Great, thank you so much, Liz. And Kelly, do you mind introducing yourself and your agency, university, as well as your fellowship project briefly?
Absolutely. Hello, everyone. My name is Kelly Knight, and I'm an associate professor at Montana State University. I'm also a project leader for the Center for American Indian and Rural Health Equity, which is on the Montana State campus. My R2P fellowship project is focused on addressing secondary trauma among victim service providers. And we're really trying to not only build awareness around secondary trauma among victim service providers, but to also begin addressing how to resolve that trauma. I think the movement for the last several years has been about increasing knowledge that this is an issue, and that is a wonderful thing that's happened, but I think we need to begin building tools around how to actually address it, because there's a lot of evidence that it exists. And so my project is a little unusual in that the R2P fellowship is not just between myself and one other agency, but it's between myself and 8 other partners. And those partners include advocates and medical providers, legal providers, people from court, so just a whole range of people who fall under that victim service umbrella. So yeah, and also want to thank our funder for helping us move that project along. So thank you.
Great, thank you, Kelly. And then Joseph, could you introduce yourself briefly and your fellowship work as well?
Sure, good afternoon. I am Joseph Richardson, an associate professor of criminology and medical anthropology at the University of Maryland in the Departments of African American Studies and Anthropology. And I'm also the program and research director for the Capital Region Violence Intervention Program at the University of Maryland, Prince George's Hospital Center. And so I'll abbreviate Capital Region Violence Intervention Program and just call it CAPVIP. We're a hospital-based violence intervention program that provides psychosocial services primarily to male survivors of violent injury. We treat roughly at University of Maryland, Prince George's Hospital, 740 victims of violent injury a year, and a significant number of those are victims of gunshot wounds and stabbings. And so we also have a disproportionate number of young men who come into our trauma unit who are also either formally incarcerated or under some form of community supervision, meaning probation, parole, or ankle monitoring. And so the purpose of my study was to look at the intersection of criminal and trauma recidivism, and the reason why that's so important is because our program participants initially had a trauma recidivism rate of 32%, meaning 1 out of every 3 people that come into Prince George's Hospital for violent injury have been injured before, and our criminal recidivism rate was roughly 75 to 80%, and 70% of our population is under, again, some form of supervision. And so what we wanted to do was understand the context of what reentry looks like, not just from the standpoint of being discharged from a jail or a prison, but also after discharge from a hospital, and what factors would lead young men not to engage in either behaviors that would lead to re-injury or to re-arrest and conviction for a crime. And so fortunately, in the past year, we've had 116 participants, and none have returned to the hospital for re-injury, and out of those 116, only 2 of them have been re-arrested. And so we're doing digital storytelling with 10 of our participants and actually taping and filming their interviews about their lives after they were injured, and their lives with regarding their previous history of incarceration or being on probation. And then also we're doing focus groups with a group of 20 young men to get their narratives on their experiences with being injured, how they cope with it, and how they're preventing from coming back to the hospital again for violent injury and going back into the criminal justice system.
Great, thank you. Thank you, Dr. Richardson. And thank you all. Now we're going to go ahead and get started with the questions. Let me just say that most of us are familiar with some of the more traditional approaches to increasing research rigor, including ensuring that you have a large enough sample size to capture a group's perspectives, finding adequate comparison groups, especially when there are ethical concerns about trying to randomly assign individuals to some program or not, and then also measuring concepts longitudinally, such as before and after an intervention or during an individual's childhood, adolescence, and adulthood. So for all 3 of the panelists, if you feel inclined to speak about any of those issues, then please do so. But today I really want to highlight some other aspects of research rigor that we know to be equally important, but sometimes less frequently discussed, including the meaningfulness of the questions that we ask of survivors, the range of perspectives that we include, and then also the extent to which we're able to truly capture victims' experiences. So I'm going to start with our first question going to Liz. And I'd like to ask you about the work, in the work that you've been doing for your CVR fellowship, which includes developing questions for intimate partner violence survivors, How are you making sure that the questions you ask are meaningful and appropriate for victims and will give useful information to service providers? Give me 1 second to unmute you, Liz. Go ahead.
Thank you. I appreciate this question. I think so often we're so quick to design a study and get started hoping for the information. We don't put as much thought into what we're asking because everybody hears language differently, right? Words matter. I think the easy answer for this is ask as many people as possible for their input on the process and the approach, and then the actual questions as early as possible. The more you ask at the beginning, the stronger your data will be at the end. So for example, in our collaborative, we have 6 universities and then practitioners, and we spent a couple of meetings talking about what are the questions we want to ask, what's the information we want to know, and thinking about how we ask the questions, what questions we're asking, how that may be impacted by how it's being heard or where survivors are at the process. And we decided that the best thing to do would be to pose our study and our intended questions to a couple different groups. And so we took information to our membership, and we asked the dedicated domestic violence service providers if they thought that this study was needed, if it's a good idea. We read the questions that we intended to ask and collected their feedback on them. It really helps make sure that questions are culturally responsive, inclusive, that language is welcoming. We took the questions to the domestic violence housing continuum, who provide the shelter providers in DC for their input on the process and the questions. The housing task force, every time sort of amending the questions to reflect what we're hearing. And then we took that, the questionnaire design after all this input to the program we were hoping to visit and ask questions of, which is the Department of Human Services, Homeless Services. And we asked for their thoughts on the questions, if they were okay with us asking these questions, really getting their buy-in to the process to make sure that once we started, we could follow through. And after we had a draft that they were comfortable with, we piloted the questions. We made sure to include in our budget funding for survivor sort of community advisory roles so that we identified 5 survivors at a walk-in clinic that's open in DC for survivors, so it was separate from the facility that we were hoping to interview at, and asked about their experiences, not only by testing out the questions we were asking, but about what they thought about the study, whether they felt it was needed, how they were hearing the questions, always sort of fine-tuning language so that we're asking exactly what we want to hear. Then once we have done the 5 pilot interviews, we reassessed, shared back to the group, and came up with our final list of questions that we then piloted with 5 survivors in the host site, which is the Virginia Williams Family Resource Center. And so always collecting information from different stakeholders or people who may be impacted by the data or the questions you're asking to get the data. I think the more input you collect on the questions themselves, the much stronger your data will be.
Great. Thank you so much, Liz. And now the next question is for you, Kelly. I know you're working with a very big practitioner team for your CVR fellowship. What are some of the ways that you ensure that the work that you're doing and other research you've done recognizes a broad range of practitioners or victims' perspectives? And you should be able to speak, Kelly. I think I unmuted you.
Oh, okay. Oh, I'm sorry. So in thinking about this question, I wanted to try to offer some simple and practical tips. So I have 3 suggestions. The first one is stems from the fact that we began our research project using a mixed methods approach, and specifically we started our project with qualitative interviews and focus groups. with key stakeholders in our community and across the state. And the very last question that we would ask during those interviews was, who else do you think we should talk to, right? And we would often be surprised about who that should be, and we would learn all kinds of good information and increase our sample and talk to people we might not have otherwise thought to talk to. So always asking your key stakeholders, who else should I talk to? That leads to my second tip, which I think many of the people who are on this webinar probably already are aware of, but as we did our interviews and we asked our participants who we should talk to, we sort of hit a point of saturation where we would keep hearing the same names over and over again. And when we would hear those names, we would definitely make note of it and then interview them, but eventually we got to a place where we wanted to develop a community advisory board because we're using a community-based participatory research model. And we would invite those individuals to serve on our community advisory board, or what some people might think of like as a steering committee. And all our research is vetted through this advisory board. And again, checking in with them almost monthly has helped shape our project and ensure that we're getting all kinds of different perspectives, and they'll direct us to things that as researchers we might not have thought about. So I'd really support the idea of having an advisory board or a steering committee of some sort for research projects. And then the third tip that I would offer is that as we started the project, we kept the definitions of our concepts really broad. I know academics can get really marred in academic jargon, and we work in our silos, and it can sort of knife off some opportunities for learning. And so we very intentionally kept our definitions broad. We use the term victim service provider, which could include anything from law enforcement to medical providers to teachers to religious clergy, because all of those individuals and professions interact with victims or with traumatized individuals or with traumatic material, and they've all been very helpful sharing sort of a unique perspective. Another example of that is just we're interested in health outcomes, and we define health really broadly. So our some of our providers are really interested in mental health, where other providers are interested in physical health or the medical outcomes. And so keeping the definition of the term health really broad has been very helpful for us. And so those are, I hope, three practical tips. Just keep asking who else you should talk to and exploring that. Have an advisory board that can help shape your research, and keep definitions broad and out of sort of the academic genre or lexicon. So thank you.
Thank you, Kelly. Those are great tips. And then our last question is going to go to you, Joseph. Can you talk about some of the things you do when capturing survivors' stories to help encourage them to open up and be accurate as they can in their responses, and to truly explore and capture their full experiences? Give me 1 second and I will unmute you. Thank you. Go ahead.
Sure. So I want to start by saying that part of the success of our program is we have a violence intervention specialist, and his name is Che Bullock. and he was a young man who actually had participated in a previous study that I had done in the trauma unit a few years ago with 25 young men who had been violently injured. And from that study, he became my mentee and ultimately became a violence intervention specialist in our program. And so he is the person that is the first point of contact at bedside with young men who have been violently injured. So he approaches them at bedside in the hospital. And primarily, the reason why I wanted him to be on our staff is because he had been stabbed 13 times and had been in that same position of lying in the bed. And so he can make that kind of connection to the young men who have been injured because he understands where they're coming from and some of the experiences that they're going through as they're dealing with their violent injury and criminal justice involvement, because he was also incarcerated for 19 months in the D.C. jail. And so Che I allowed to also engage as a research assistant with me now, and he's completed the CITI training, and so I've trained him to also engage in the recruitment process. And so I gave Che kind of free leeway to select the young men who he thought would be best to participate in this project. And so a lot of the success is based on having someone that's part of your research team having a connection to the participants. I know the participant stories as well because I deal with them a lot, and so it was between myself and Che exchanging information about the participants in our study. It was easy to construct an interview instrument that would address many of the questions that we wanted to know about. Some of those questions are around PTSD and how young men cope with PTSD after they've been injured, and many of them have already gone through group counseling and individual counseling, so they understand the symptoms of PTSD and some of their coping mechanisms. And so what we basically ask our young guys to do is just be completely honest about giving their stories, and that their stories would be used to help other individuals who may not have the access to a hospital violence intervention program, because at this point in time there are only 35 in the country. And so what we're hoping is that some of the stories that we've collected will resonate with many of the young men who are out there who may hear these stories and understand the stories and may lead them to getting mental health services, but also for service providers that do this kind of work so they can intimately hear the stories of young men who have been injured. And so we have some young men in our study that have been shot on 3 separate occasions, right? We have a young guy who's 19 years old. He was shot every year from the time that he was 17, and he's been incarcerated multiple times. And so what we just ask our guys to do is be very open and honest, and if they choose to not answer a question, they have the right to do so, and we make that very clear from the outset of filming. If they decide that they want to discontinue even participating in the project, they can, and we always offer that as an option. But what I found is that once we turn the camera on, we can't get guys to stop talking. And so that's a really good and positive aspect of the digital storytelling process, that I think many of these young men really want people to hear their stories because they are committed to improving the lives of other people who have been violently injured. And so what I find to really be fascinating and I'm very passionate about is and I'm very proud of is the mere fact that we have young men who are not only willing to tell their story, but hoping that their story changes the narratives and the way that systems treat them, particularly the criminal justice system and the healthcare system, because they're often criminalized in both. And what we found in previous studies is that a history of incarceration actually is the most significant risk factor for bringing someone back to the hospital again, which is why we selected young men who have histories of criminal justice involvement that have also been injured. And so I think it's groundbreaking work that we're doing. I don't know of any other hospital violence intervention program that has is doing digital story with a university that's doing digital storytelling on young men who have been injured but have also had histories of criminal justice involvement, and I hope that it could be used to inform more programs, and particularly how hospital violence intervention programs interact with the criminal justice system. And so the last thing I would say is, last week I was at the National Academy of Sciences, and they had a conference on firearm-related injury and service provision, and I raised a question about the lack of discussion around the criminal justice system with people who have been violently injured, and there was basically no response from many of the panelists on why we don't discuss that. And so considering that we have high criminal recidivism rates and trauma recidivism rates among our populations, it's important that we let our young men know that they have a story to tell and that their story will have a significant impact on programs and systems and also individuals who may find themselves in the same predicament.
Wonderful. Thank you so much, Dr. Richardson. Thank you to everybody. It's very powerful and helpful information about the great things that you're all doing. And so I'd just like to say also thank you to everybody who's joined this meeting, obviously especially to our panelists for sharing their knowledge and experience with all of us. If anybody has any questions or you would like further information about this panel, please visit the Center for Victim Research website at www.victimresearch.org. You can find some tools and tips on research and evaluation, as well as access to CVR's library of research materials. And this concludes our 30-minute panel. We hope that you all have a wonderful rest of your day.